Well, hello, everybody. Good afternoon. This is your City Council President, Felicia Moore. Welcome to another installment of Conversations with the Council President. And today I have some wonderful guests, and I'm looking forward to it. Looking forward to this conversation because it's very timely. And while everybody is sick of COVID, and I certainly understand that, we have a flu season that's coming. And so we need to be cautious and careful to make sure that we're taking care of ourselves. And that's very important. So today we are joined by representatives from Kaiser Permanente. Now that fall season is upon us, and we are tasked with managing both what was going on with COVID, pandemic, and the flu season, what they're calling a twindemic, or we're trying to avoid a twindemic. The doctors from Kaiser Permanente are here to update us on the status of COVID-19 in our communities and talk to us about the importance of flu vaccinations. So I want to welcome the doctors that I've asked them, and I'm going to ask them to introduce themselves. And so if they will unmute and turn their cameras on, we'll start with Dr. Forna. Okay.
Hi.
Introduce yourself.
Yeah, good afternoon, everyone. My name is Dr.
I'm hearing her, TJ, or at least I'm not. Oh, I know why I'm not hearing you. Hold on one second, Dr. Forna. Okay, now go.
All right. Good afternoon, everyone. And it's a pleasure to join today. My name is Dr. Fatu Forna. I am an OBGYN and epidemiologist, and I am the Physician Program Director for Perinatal Safety and Quality at Kaiser Permanente, which means that I'm part of a group that works very hard to keep our pregnant women and their babies safe.
Yes, well, thank you so much. And Dr. Griffin, if you could introduce yourself.
Well, can everyone see me?
We can't see you. Your camera's off.
Let me see if I can cut it on. It says.
There you are.
You see me? Okay, great. Well, hello, everyone, and thank you for having us at this forum, Council President. My name is Dr. Chris Griffith, and I'm a psychiatrist and obesity medicine specialist. I'm originally from Cincinnati, Ohio, and I am very happy to be here with you today to share some information about how to keep us all safe during these challenging times of pandemic and, of course, injustice in the street.
Thank you. And Dr. Pimentel.
Yes. Okay.
There you are. Hi.
There I am. Hi. Good afternoon, everybody. Thank you so much for having us. I'm Belkis Pimentel, and I actually grew up in Jersey, but I have been in Georgia for the past 25 years. And I am a family physician working at Kaiser now for the past 11 years. And in my position as Physician Program Director for Quality Performance and Population Health. Happy to be here. Thank you so much.
All right, and people on Facebook are saying hello to you all. And so I'm going to ask a few questions. So how are we faring locally, do you all think, relative to responding to COVID-19? Are we in better place in terms of suppressing the disease? And we can start as we introduced ourselves, just to get your perspective from each of you. Dr. Forna?
Yes, I do think we are learning a lot. When the pandemic started, we didn't know a lot. We've had some time now, and we know what we need to do to keep ourselves and each other safe. And I think we have a lot of opportunity to do better. We're not doing as good as we could be doing. We're seeing infections rising, so I think as a community, we can do a lot better to put on our masks, to make sure we're socially distant and limit our activities. And in doing so, we can keep ourselves and the people around us safe.
Dr. Griffith, how do you think we're doing?
I have very grave concerns. particularly in our community. Where I am, I see people without masks, having very large gatherings, as if everything's fine. One thing we know about this disease is the laws of nature are unforgiving. And in order to adjust, we have to get in line with what nature and science says. This disease affects our people more, with greater consequences, with greater, as we say, death, morbidity, mortality. And, as it stands, as the rate of infection and death continues to rise, our life expectancy for people of color is already the lowest, and it is going down. So we have an opportunity now to do something to put the brakes on, to pause, to wear our masks, to socially distance, and to also to get the flu shot. And so why they to get the flu shot is this. So think about this. It's very
We're gonna get to that before
Okay,
before
go
we
ahead.
get to the flu shot. I want to give from Dr.
Pimentel.
Pimentel how she thinks we're faring.
Thank you. So I agree with both of my colleagues, Dr. Pooner and Dr. Griffith. It is a tough time, and COVID-19 is something that we haven't seen before, but we have learned quite a bit. And doing some simple things, we can keep ourselves safe so we're not caught up in what Dr. Griffith was talking about in the consequences of COVID-19. So I think that's a really important message that we want to make sure that you take home, is to do the things to prevent you from getting COVID-19, especially for people of color, since we've seen some grave consequences more for that population. And there were just 4 things: just wash your hands, wear your mask, socially distance, and get your flu shot.
Okay, well, Dr. Pimentel, I'm going to start with you on my next question because we're just talking about COVID now, but we are going to talk about that flu vaccine. So, what are you seeing in Kaiser Permanente facilities, Dr. Pimentel, in terms of symptoms for both adults and kids?
For COVID or for flu?
COVID, we're just talking COVID right now.
Gotcha. So COVID is actually very variable. The symptoms in Kaiser is not any different than the rest of the US or the rest of the world. So lots of people are asymptomatic, but most people will have either fever accompanied by cough and shortness of breath. And that shortness of breath can come on suddenly and it can be severe. Something that's pretty different from flu, where you're not usually feeling short of breath, but a lot of the symptoms are similar to the flu illness. So sometimes a little difficult to tell them apart, but right now, since we have COVID going around, we know that it's COVID. One of the symptoms that are pretty unique to COVID that we've learned is the loss of taste and smell. And other symptoms that you can have are pretty general. So headache, being really tired, having just upper congestion symptoms like sore throat, nasal congestion. But the fevers can be on and off, body aches, so things like that.
Dr. Griffith, what type of people are presenting in terms of, are you seeing kids, Dr. Griffith? Are you seeing adults? Are you seeing a lot of one or the other, Dr. Griffith? What are you seeing?
Well, one of the things that we have been doing personally in our practice in behavioral health, we have been doing all virtual appointments to protect ourselves and our patients from this virus. I mean, at what point in history have you ever had a condition where you can shake someone's hand and then a week later be dead? And so, in the patients I've seen, they have on video, they have shared exactly the same things that Dr. Pimentel verbalizes. I'm very fortunate that these people have survived, but my daughter and son-in-law to be both came down with it, and it was very frightening for us. And fortunately, they have recovered, but each of them still have some lingering respiratory issues.
Dr. Forner, what about you?
Yeah, so I'll talk a little bit about the pregnant women. When this pandemic started, as we know, pregnant women, there are two patients were thinking about the pregnant woman and the baby, and people were very scared. We have seen kind of similar things with other adults. We know in general that pregnant women do get sicker from infections like the flu, and we suspected that they would get sicker from COVID, and in fact, the CDC has confirmed that they're at a higher risk of getting gravely ill, being in the intensive care unit and having worse outcomes. So we have seen some of that where there are pregnant women who have had to be in the intensive care unit, have had to be intubated with a tube down their throat, and have had a difficult course. We have also seen some pregnant women who have no symptoms at all. The only way we know is because we screen everyone who comes in to deliver their baby. So for pregnant women, they need to take extra precautions because they are at higher risk than the regular population of getting really sick.
So when a pregnant woman gets COVID, what about the infant?
Yeah, so that's a very good concern. What we do know is that COVID doesn't cross the placenta very easily. They have had some case reports, but in general, we've been seeing babies who have been born and not infected so far. However, when babies do go home with mom, you have to breastfeed and there's close contact. So there is a chance of the baby getting infected then. But thankfully, what we've been seeing is that the babies that have been born have not been infected.
Okay. Well, now let's talk about the fact that we want to avoid what they're calling a twindemic, and tell us about why it's important for people to get the flu shot. And I'll start with Dr. Griffins because he wanted to jump on that earlier on.
So, as my colleagues have shared, both conditions, both infectious viruses present with similar symptoms of fever, chills, cough, headache that can progress. And so the novel coronavirus is exactly that. It's novel. It's a new virus that we've not had any exposure to. Now, the flu has been around for a long time. So it's very possible that you could get co-infected with both at the same time. So the example I like to give people about how you protect yourself is this. Let's say we're on a boat, two people on a boat in the middle of a storm. One's got a life jacket on, one doesn't. They both get thrown overboard. Now, it's very possible during the storm that the waves overtake them and both of them drown. However, the one that has the life jacket on has the better chance. That's the flu shot. One without the life jacket, that's COVID. So we have to do what we can to protect ourselves from this onslaught. And it's even more important today that we protect ourselves because this is also a measure of social justice. You got to be alive so you can vote.
Yeah. So I want to ask too, and I'll ask Dr. Pimentel in terms of this, people have always had some concern about the flu shot. Let's just deal with that in and of itself and its effectiveness. And some people haven't gotten the flu shot. And I've also heard on the news where they say that if we practice the social distancing, washing our hands, that kind of thing, that it would keep us from getting the flu just as it would COVID. But why would you say, even with that knowledge, that we should still get this shot?
Thank you for that opportunity, President. So the flu vaccine actually oftentimes a lot of people will say that, oh, it made them sick or it had some side effects. But actually what they are thinking it's being sick. It's actually just an appropriate immune response from your body. Usually happens a couple of hours and lasts no more than a day. So it's a little bit of fever, a little bit of body aches, maybe a little bit of sniffles. That's it. But you can't catch the flu from the flu vaccine because it doesn't have live virus in it. So that's one myth. The other one about the effectiveness. So over the past almost 100 years, we've had flu vaccines, and they get better with being able to tell what's the viral strain that's going to be affecting us this year. And there's lots of smart people who are on that. And sometimes they get it wrong, or just that the flu virus mutates and it changes, and it changes during the season. So that sometimes will affect the effectiveness of it. So in general, the flu vaccine has been effective about 40 to 60% of the time. So people, well, why should I get it, right? They actually have seen that when people get the flu vaccine and they get the flu, even if it's not stopping them from getting the actual flu illness, it actually reduces the symptoms they have. So the symptoms are milder. The other thing that's really important to remember is that the flu vaccine really has shown to reduce the risk of the complications similar to COVID. You end up in the hospital with severe pneumonia. You end up in the ICU, you end up on the respirator, and even worse, death. Thousands of deaths every single year from a disease that's preventable. And the flu vaccine has shown to reduce that risk.
Well, I'm going to ask Dr. Forner a couple questions, and then I'm going to take questions. The people, if you haven't given me your question, please make sure. But I'm going to say you are right about that, because I got the flu maybe about 10, 15 years ago, and I swore I would never miss another flu shot because I thought I was I was so sick, I thought I was out of here. And so I'm very good about getting my flu shots. And then right before COVID even came out, I wasn't feeling well, and I'm like, I don't know what's going on. So I went to Kaiser because I'm a Kaiser patient out to the, I think it's South Lake where it's the extended thing. And the doctor, did the thing up your nose and everything. He said, well, you have the flu. And I'm like, but I had a flu shot. And he said, well, but you still have the flu. But I will tell you, I would have never thought I had the flu based on it didn't last long. I got the Tamiflu. It was about gone, and it was a whole different experience than when I really had the flu and had not had that flu shot. So I'm just telling people, if you even get the flu, which for all those years I never did, it will be so mild that you will thank yourself. And with this COVID, really asks you to consider it. So Dr. Forner, can you tell us what is Kaiser doing and what is the vaccination program? And since you mentioned pregnant women, do they get flu shots?
Yes, absolutely. So pregnant women are one of the very high risk groups where if they get the flu, they can be very sick. I've taken care of many pregnant women in the intensive care unit, deathly ill from the flu. So we recommend that all pregnant women, whether they're early, in the middle, or in the end, get the flu shot because it helps protect them. It also helps protect their newborn babies from getting the flu. And in the setting of COVID, because those symptoms are so similar, you do not want to be in a situation where you have a fever and a headache and you're worried about whether you have COVID or you have the flu. So getting the flu shot for everyone, and especially for pregnant women, is very important. Kaiser Permanente, has done very well in trying to reach out to our members to make sure we all get the flu shot because it's so important. I think our main goal is to make sure we're keeping people safe. I can use myself for an example. One of the things that we've done at Kaiser is we have drive-through flu clinics every day where you can just get in a car and drive through one of our offices and get a flu shot. So myself and my 4 children, just a couple of days ago, we got in our car, drove through, and it literally took 5 minutes. They went around, looked at our cards, and went to each door and gave everyone a flu shot, and it worked beautifully. So whether you have Kaiser Permanente or you have another insurance, you really need to reach out to your clinician or your physician and make sure you're getting the flu shot now before the flu season starts.
Okay, wonderful. Wonderful. So I'm gonna drive through and get my flu shot real soon. I'm gonna be in that number. So we have several questions from the public. So I'm gonna do them rapid fire. I'll start with you, Dr. Forna. You'll have to hope you can answer this question. That doesn't make sense. Why doesn't it? Someone is asking, I'm gonna ask Dr. Griffin this because this was one of the things he was talking about. They want to know why COVID affects the African American community worse. Is it genetic or is it socio environmental?
Okay. So what basically it is, it's not genetics, but it's what we call social determinants of health that are a combination of where you live, the jobs you have, your access and typically lack of access to healthcare. And so there's this condition called health disparities, which basically is why we have greater complications for cancer, diabetes, heart disease, everything. And so COVID is the perfect example. It highlights this. So many of us are frontline workers that because of, we're less likely to have healthcare, more likely perhaps to use public transportation, more commonly in positions where you are having direct contact with customers and patrons. So, I'm very fortunate and blessed. I'm able to be here in a safe office with PPEs and screening people who come into the office, whereas, someone else just right down the street from me here in Lithonia who's working at a restaurant, they don't necessarily have that. And then with the relaxing of standards, it's an explosion. It's an onslaught. And so this is where we have a responsibility, especially to help our people. And this is how we do it, by educating and giving them the right information about these conditions. It ties also into this flu as well. We're more likely to experience complications from the flu. We're more likely to have complications from heart attacks, strokes, cancers, just like Dr. Forno was referencing. Black women have a greater chance of dying in the hospital. Their babies have a greater chance of dying in the hospital compared to non-white. So COVID is just an extension of these other health conditions. And that's one of the things that we're invested in Kaiser Permanente, is eliminating health disparities.
Thank you. Dr. Pimentel, I'm going to give you this question. My other question is the effectiveness of the flu shot and the new variant. And then I'm going to add to that, what was the question? Is COVID a virus or a retrovirus? Dr. Pimentel?
Oh, sorry. Yeah, I haven't. Okay, there we go. Thank you. Thank you for that question. So the effectiveness of the flu actually is different every single year, depending on the strains that are in the vaccine and what's circulating. And sometimes, not every year, sometimes there are some mutations during the actual flu season, and then that will make it less effective. But as we already talked about, even if it's less effective, it does decrease your risk for getting in a hospital or having an ICU admission. And about the effectiveness, something I just want to point out, Dr. Griffith and Dr. Forna talked about chronic conditions. That is actually in the African American population more than any other populations, like diabetes. And so because of that, we actually had increased risk also for complications, not only from COVID, but also the flu, and that's been shown. And it's been shown that the flu vaccine actually reduces the risk if you have those conditions. So much like if you have heart disease and you get a flu vaccine, there's 30% less chance that you will have a risk of being hospitalized. So you want to make sure, especially if you have a chronic condition, to get the flu vaccine. And even if you don't have a chronic condition, if you get the flu, you're more likely to have a heart attack after getting flu. You want to make sure that you get protected.
And so, Dr. Forna, I'm going to give you the last two questions. What does flu effectiveness 40 to 50% of the time mean? Is that 40 to 50% of the population? Is that what that means? And then their final question is, what are your thoughts, or what are any of your thoughts on reopenings of schools?
The effectiveness of the vaccine that Dr. Pimentel was talking about is the chances that this vaccine is going to work well against the particular strain that's circulating. So the chances that it's going to work in decreasing your risk of getting the flu. So that's what he was talking about. For opening of schools, you know, that's something that's really specific to where you are, you know, and, you know, what's the level of infection in your particular area. And, you know, in Georgia, we do have high rates of COVID, and, you know, we're seeing different things in different school systems where some people are staying home and some people are leaving it up to parents to make that decision. I can share for myself, you know, my husband's a pediatrician, and we decided that given what's going on, we wanted to keep our children home because of the high rates of infection. To keep not only, and it's not only about keeping your children safe, we were in a situation where, as many people, we live in multi-generational homes. My mother was with me, and we wanted to keep her safe also. So lots of things that come into play.
Well, I want to thank you all. We could probably talk for another half an hour, but I want to be respectful of everyone's time, those that are listening as well as you. I know you all are very busy in these days, and I want to thank you, first of all, for everything that you've said, because it's been enlightening, but two, just for serving, because you all are on the front lines of this. I mean, you are caring for people that could make you sick as well. And you have families and friends. And so we want to thank you for stepping up and serving our community. Thank you, Dr. Forna. Thank you, Dr. Griffith. Thank you, Dr. Pimentel. Thank you, Kaiser Permanente, for letting them come and share with us. And we may have to do this again because COVID and flu may be around for a while, and we'll have to discuss it. So you all take care. Thank you. Thank you so much.
Thank you,
Thank you for
President.
having
Bye now.
us.
Thank you.
You're
Bye-bye.
welcome. Thank you. So I want to thank the doctors, and again, Kaiser Permanente. And I now want to just wrap up because we have run out of our time. And thank you all for your great questions that you've given us. So as we know, the city is still in the midst of the COVID-19 pandemic. Please, as they have talked about, take the precautions. This is not a political statement, whether you wear a mask or not. It's just respectful to other people that you're around and to protect yourself as well. So please do that. Social distance and use your proper hand washing. I also want to make a big appeal to those in the age range of maybe 18 to 29, 30, young people. You are out here and you are really putting a lot of people at risk. I see you. And if we can get our guests to mute their phones, I see you out here and you are in groups and gathering, and you're going home to your grandmother, your mother, your aunts, your uncles, your friends, and you are perhaps spreading this because you may be asymptomatic. Also encourage everyone to get tested if you haven't gotten tested. I try to do it as regularly as I can. There are plenty of locations. They're doing it for free. I know this is tiring. We want this to be over, but it's not going to be over until we get responsible and we all collectively do what we can. Again, I encourage people who are whichever platform you're on. We're on YouTube now live, and I do see it's up. We're on Twitter live, and we're on Facebook. And so if you know people who aren't on Facebook who would like to join in, please let them know that they can catch us on Twitter or on YouTube channel in the future. If your neighborhood or community organization is meeting virtually, and I know many MPUs and community neighborhood groups are doing that, I'd love to join you. So please make sure you send an email to my office, and we will try to get me on your schedule so that we can talk and I can hear what is going on in your particular neighborhood. So look for the announcement for next week's committee meetings. Next week, we have all of the standing committees except for zoning and committee on council meetings. So that will be public safety, where you can leave your comment, public comment for them. You have city utilities, community development, human services committee, as well as our transportation committee and finance executive committee. So please stay involved and stay educated and keep sending us your comments virtually. So I thank you all for joining us. This has been another very, very informative conversations with the council president. Thank you all and have a good day, and do your precautions, wash your hands, social distance, and please wear a mask and wear it properly, not under your chin, not under your nose, wear it fully, and take care of yourself and your fellow neighbors. Take care. Bye-bye.